હેલો એવરીવન, કેમ છો બધા? ગુજરાત ગૌણ સેવા પસંદગી મંડળ દ્વારા જે અત્યારે 138 વેકેન્સી માટે જે આપણે ભરતી આવી છે તેના માટે માય નર્સિંગ એકેડમી રાજકોટ દ્વારા એક કોર્સ શરૂ કરવામાં આવ્યો છે કે માય નર્સિંગ એકેડમી દ્વારા ફિઝિયોથેરાપી કોમ્પિટિટિવ એક્ઝામ કોર્સ. અહીંયા આપણને ઓલ સબ્જેક્ટ્સ મીન્સ એનાટોમી, ફિઝિયોલોજી, મેથ્સ, રિઝનિંગ, ઓલ ધ સિલેબસ જે આપણી ગૌણ સેવાએ આપણને જે સિલેબસમાં જે બધા સબ્જેક્ટ્સ આવ્યા છે તેનું ક્વિક રિવિઝન આપણે કરાવવામાં આવશે અને બધા ટોપિક્સ જે છે એ કવર કરવામાં આવશે. સાથે સાથે એક્સપર્ટ ફેકલ્ટીઝ અમારી સાથે ફિઝિયોથેરાપિસ્ટની એવી ટીમ છે કે જે લોકો પોતાની ફિલ્ડમાં તેમનો અનુભવ અને સાથે સાથે તેમની એક્સપર્ટીઝ છે. સાથે સાથે ઓનલાઈન એન્ડ ઓફલાઈન મોડ્સ, ઓનલાઈનની સાથે સાથે અમે ઓફલાઈન બેચીસ પણ શરૂ કરી છે કે જે લોકોને સિરિયસલી અહીંયા આવીને જેને ભણવું છે તે લોકો ભણી શકે છે. એની સાથે કોમ્પ્રિહેન્સિવ સ્ટડી મટીરિયલ્સ, અમે અહીંયાથી ક્વિક નોટ્સ આપણે જે અહીંયા સ્ટડી કરીએ છીએ તેની પીપીટીઝ સાથે સાથે તેમના એમસીક્યુ બેંક્સ સાથે સાથે ડાઉટ ક્લિયરન્સ સેશન્સ આ બધું તમને અમારી એકેડમી દ્વારા પૂરું પાડવામાં આવશે. સાથે સાથે અમે રેગ્યુલર વીકલી ટેસ્ટ લેશું, ડાઉટ સેશન્સ પણ અમારો હશે અને સાથે સાથે આપણી જે કોર્સ જે છે એ ખાલી ને ખાલી એક્ઝામ ઓરિએન્ટેડ છે કે એમસીક્યુ રિલેટેડ, થિયરી બેઝડ નહીં પણ એમસીક્યુ રિલેટેડ છે કે જ્યાં તમારા બધા એમસીક્યુઝ અમે સોલ્વ કરાવીશું. તો આ જે એકેડમી છે તે હમણાં જ શરૂ થઈ ગઈ છે, તો વહેલી તકે જોડાવ અને સાથે સાથે ગુજરાત ગૌણ સેવા દ્વારા જે ભરતી આવી છે તેને ક્રેક કરો તેવી શુભેચ્છા. માય સેલ્ફ ડૉક્ટર મૌલિક પરમાર. So hello, myself Dr. Maulik Parmar, BPT and BA in Psychology. Today I will teach you about the motivations and emotion. Before we start, let me ask one question. What you made to wake up in the early morning? What? Alarm? No? Fear of wife or fear of parents? Yes or no? No. Right. If you are waking up in the early morning and your morning start with the motivations. Right. And right now you are watching my lecture. Yeah? How are you feeling right now? Feeling sleepy, feeling bored, feeling excited, feeling surprised? What? Whatever you are feeling right now, that is emotions. First we starting with the motivation. What is motivation? Motivation refers to the internal and external forces that initiate. Initiate means to start the activity. To start a activity. જો તમારે કંઈક વર્ક કરવું હશે તો એની શરૂઆત ક્યારથી થશે? મોટિવેશનથી. બરાબર છે? Then direct. It will give you a direction towards your goal. Right? Motivations જો બધાને ખ્યાલ જ હશે. Why are you choosing a medical field? In physiotherapy profession, what made you to choose a physiotherapy? You choose by yourself? Yes or no? Okay. Then again question. Others are maybe choose a physiotherapy by a family pressure also. Right? That will give you a direction towards your goal. If you choose by yourself, then it's a internal force. But you choose by your family pressure, then it's the external force. Right? And the sustained behavior. Motivation gives you a direction towards a sustained behavior. If you want to do a work until like if you are having the exam tomorrow, right? Then you need to work. You need to work hard to crack the exam, to pass the exam, right? Then it's give you a sustained behavior like to read whole night, right? Yes. Then term motivation is derived from the Latin word. It's too much important. In MCQ, they are asking the derivation of the words, right? Latin words, its motivation means to movers, to move, to move. It's like a dynamic in nature, right? If you are starting your morning with the high motivation, it will not long last for the night also, right? You will feel a tiredness, you will feel a boring, you bored, right? Then motivation explains why an individual behaves in a particular manner. If you want to behave in the particular manner, then it needs to have some kind of the motivation. Like if two peoples are there, both are doing the same work, right? Me and you are reading in the same place, same environment, same time, but the goal of the both are different, right? You are studying for your knowledge, but I'm studying because I want to pass the exam. Else, no, not the reason. It's the motivation is like that. Everyone's have a goals, but they are not in the that like that. They are not having the special reason. They don't know about the reason to how to study, how to start, how to end up with that. Okay. Now, nature of motivation. Motivation is the dynamic and continuous process. Dynamic. Dynamic is the important word, right? For example, patient comes with you. If the patient is stroke, he is coming for the treatment since last 2 years, right? But the improvement is not there. So why patient come to us? For recovery, right? Right, na? For recovery. So if you are not giving any kind of the result to your patient, then its motivation goes down, right? If you are giving the recovery in the initial period of time, then patient motivation got increased, right? It's like that. Its motivation is in the dynamic in nature and the continuous process. Motivation, if you are watching a motivational speaker, at that time your motivation goes in the high speech, right? At that time you will think like that, I will do exercise next early morning and I will do a gym and I will go for the what? A particular timetable wise, right? You make a timetable, the 13 hours of studying, 2 hours of break, right? You will do all the things if your motivation goes into high, but it's the continuous process. It will go down, it will increase, it will decrease, right? Then what is motivation? Is the goal directed in nature. Goal directed. If you are having the any kind of thick goal, its reason behind that is the motivation. If like the what can I say? If you want to study in the neuro subject, right? In neuro, if you are opening the book, then you don't understand very well in neuro, right? Because brain structure is too difficult in nature that it will get confused, right? At that time, if your goal, if you are like the subject, if you are like the neuro subject, then the capacity of the remembering of the memory, it will goes into high direction, right? Then motivation may be conscious or unconscious, right? Motivation conscious or unconscious means, for example, I want to buy a new clothes, right? I will buy a full expensive clothes because I am rich, right? No, I want to buy expensive clothes. Somewhat they are having the reason behind it, but somewhat are not reason behind it, because सबके पास है, दूसरे के पास है, इसलिए मुझे लेना है, right? That's the reason, right? It's the conscious or unconscious. Somewhat know the reason, somewhat not know the reason. Then influence the learning, performance and behavior. Learning, it's the important terms, right? If you are the high motivation, at that time your learning capacity, at that time your performance capacity, it will increase, right? But if you are having the low motivation and someone asks to study for 2 hours, right? At that time you will not get study. You don't remember. You will sit and you read, but you didn't know how to read, what to read, what are you reading, even you don't know, right? So now we go for the types of motivation. It's two important types of motivation. Two types are there, intrinsic and extrinsic. Let me say, intrinsic motivation comes from the within the individual, right? If I think I want to do regular based exercise, I want to do a gym, then it's the intrinsic motivation type. And I paid a full fees of gym, and then I have to do a exercise, right? It's the extrinsic motivation. That motivation comes from the external reward as well as the pressure. It's known as the extrinsic motivation. Intrinsic motivation is like the derived from the interest, enjoyment and satisfaction. See, if I want to treat if I have a more masters or if I like to treat a ortho condition, then it my interest, right? कि ऑर्थो कंडीशन में मुझे ट्रीट करना है तो मैं उसको आराम से कर सकता हूँ हाई मोटिवेशन के साथ. इफ दे आर गिव यू अ चाइल्ड, right, and if you are not interested in child, right, what happen? You will not treat properly, right? You have some kind of the frustration in your mind. You will have a motivation for some few days in starting initial days, but after that you will not have, right? So it's like the interest, enjoyment and satisfaction. If you are getting a satisfaction by treating the patient, it's like the intrinsic. Then extrinsic, if you are treating the patient like for the salary, for the money, then it's the extrinsic type. See, let me give you one example. You are working in the private setup or the government setup, like the salary based, right? But now right now you are not feeling well, but you don't have to go over the workplace, but right, but you have to go. आपको जाना पड़ेगा. क्यों? आप जा रहे हो. क्यों? आपको पैसे चाहिए, क्योंकि वो सैलरी से कट होंगे. ये मोटिवेशन मिला, ये एक्सट्रिंसिक मोटिवेशन है, राइट? आप गए वहाँ पर पेशेंट करोगे, जैसे जैसे होता है वैसे ट्रीट कर देंगे, राइट ना? It's like the extrinsic motivation derived from the money, grades, praise and punishment, right? Here we are having some kind of the examples like the studying because you enjoy learning. This point is not too much, right? A physiotherapist is treating a patient due to the personal satisfaction, right? It's the intrinsic type. And extrinsic, for example, studying to score a marks. Everyone, I want to give a Gon Seva exam. Why? To get a job, to get a high pay scale, right? Yes or no? Yes, na? It's extrinsic motivation. Working for the salary or promotion, right? Okay. Then we go for the biological motives. In our body, we are having the biological motives also, right? Biological motives are that our body will say to do a work, to an activity, right? Biological motives are related to the physiological needs. Physiological needs. This include hunger, thirst, sex and sleep. If you are hungry and you are not having the food, what you will do? What you will do? You will go outside, you will find some kind of the food, right? But you are not having the money. What will you do? You have to do a work for the money and food, right? These are the things, are the basic needs of the human being. If you want to fulfill a basic needs, then we require a motivation, right? Same like that, sleep only. If you are studying too well, right, 16 hours, then your sleep will be not going to come. You will continue for the few weeks, but sleep is necessary for our body, right? Your body will get tired and you will have a motivation to sleep, right? Then biological motives are essential for the survival. If the biological motives are not that, we will not survive, right? Then they operate on the principle of homeostasis. It's too important. Homeostasis means to balance our body. If you are feeling thirsty, then body gives a signal, drink water, right? It's like the homeostasis. It's biological motives only. Then we see a social motives. Social motives develop through what is the society? Whenever we are living, it's society, right? Right, na? Yes. So society develop social motives develop through an interaction with the society. If you are interacting with the society, it's give you a motivation for the higher fulfillment. See, if you are having like for example, आपके पास घर है वो 2 BHK का है और दूसरों के पास जो है वो 3 BHK में जी रहे रो हाउस में है, तो आप क्या करोगे? आपके अंदर मोटिवेशन आएगा कि मुझे भी ये चाहिए, मुझे भी ये बनाना है. Its motivation, it's derived from the interaction with the society. It has a social motives, right? Then achievement motives refer to the desire of success. Achievement motives. If you want to achieve, right, a first grade in the which standard? In your college, you have to become a gold medalist. What you have to do? You have to work hard. You have to do a hard work as well as the smart study. Then and then you will get a gold medal. It's like to grab something, to achieve something, you have some kind of the motives. It's known as the achieve motives, right? Then we have a affiliation motive, refers to the need of social relationship. See, in society we have a more kind of the what? In society we are having the more kind of the people that are, we have to maintain some kind of the relations with the other peoples. At that time, that motivation, that motives arise, it's known as the affiliation motives. Then power motives refers to the desire of influence other. See, if I want to influence, sorry for that. We have to, like in motivation, we are having the Maslow's hierarchy needs, right? Maslow's hierarchy needs is like the thing we have to know, do. It's give us triangular, it's give a motivation to an increase in the needs. First, people are having the physiological needs. We talked about the hunger, sleep, thirst, sex, that are the physiological needs, that are the basic needs. If you are fulfilling that needs, it's give you a motivation to safety and security. Safety and security include the health, employment, property, and family and social ability, right? If you are feeling breathing, food, water, shelter, clothing and sleep, these are the factor you have achieved, right? You all are having that kind of the basic needs you fulfilled, right? Then you go for the safety and security, like the health, employment. These are the needs that are basically divided into the five component. First, physiological needs, safety and security, love and belonging, self-esteem and self-actualization, right? Then safety and security, after you go for the love and belonging, right? Friendship, family, intimacy, sense of connection. These are the social motives. First, physiological motives, then after safety and security, and then social motives, then self-esteem. You will have, if you got a two step of the needs, then you have other like the third one, right? Self-esteem. And the last one is the self-actualizations. You have acceptance, experience of purpose, meaning in the inner potential, will develop inner potential in the last stage, right? Now we go for the theories of motivation. Mainly we are having the three theories. Motivation have more theories, but in exam point of view, they will ask about the only three theories that are too important in nature. Theories of motivation. First one is the dive reduction theory of the motivation that is given by the Hull. It's too important because the Hull is the only psychologist that gives the theories of motivation and they gives a basic concept of the motivation, right? Drive reduction theory, it says like that to reduce the tension, right? See, drive reduction theory is like that. If you are feeling thirsty, then what will you do? To drink water. Drive reduction theory is, it is saying like that. If you want to have some kind of the needs, you will fulfill. You can fulfill by the whichever things, whichever component it's required to you, right? Then incentive theories of motivation, this given by the Skinner. You all know about the conditioning, right? वो कुत्ते वाला जो आता था ना पढ़ाने में, पावलोव ने जो दिया था. It's like the Skinner said that if you will have external reward, if you give us someone to earn reward, then person will do all the activity, right? If you are giving the some, like the, for example, if you are feeling too much hunger and someone asks to eat a burger or pizza, what will you do? You will eat, right? Because it's your need. You have to do, you have to fulfill your need, right? That's only by the external reward. For example, if the competitions of the batches are divided, if I give you a mock test to you and I have, you guys are 50, right? 50, and I external reward I kept like that. If you are giving, if first 3 rankers are given a standard book of the 500 MCQ that are most important in your Gonaseva exam, what happened? You will do a preparation, you will do a more study for external reward, right? That's what the Skinner said is only like that. The expectancy theories of motivation, it's given by the Victor Vroom. That is like that, belief plus outcomes. If you know, if you are believing it will happen, and you are having the also you also know about the outcomes, then you will do, right? If I know benefits of exercise, right, and I also know about the what exercise what will give you the outcome, right? If you are having the ONE at the age of teenage, you are not having the OA, but you are having the some kind of the other condition, right? What will you do? You will do exercise. You have a belief on exercise, right? You also know about the outcomes, then you will do it. Like the expectancy theory, it's given by the Vroom, right? Now we starting with the emotions. Motivation is like that, what you have to do, right? Emotions is like that, what you are feeling, particular time, particular situation, what you are feeling, it's like the emotions. Emotions is a complex test that involving feeling, physiological arousal and expression. Feeling, what you are feeling right now? What? You are feeling bored, right? Right, na? Yeah, that feelings. Then physiological arousal. Physiological arousal is like that. If you are in the dangerous situation, right, what will happen? Your heart rate will go up, right? Your hand and feet are shaking, right? Right, na? Then what others occur? Your muscle tension will increase. Then you will have a physiological arousal, right? Then the expression, what expression you will give? It's like the facial expression, right? If you are angry, then how will you express your feeling, right? If you are sad, how will you express? Right? That are the expression that gives you emotions. They are the symbol of emotions, right? Now, emotions usually intense and short lasting. See, if you are angry on someone, right, what will occur? It will intense. Right now it is intense, right? If you are feeling angry, what will you do? You do a someone like, right, na? It intense and short lasting. If you are feeling angry, it's for the short term period, right? Short period of time. Then you will have some kind of, right? Then emotion influence the perception and behavior, right? Now, components of emotions. In emotions, we are having the mainly three components: physiological, behavioral and cognitive. In physiological components, it's like that body's automatic reaction. Automatic reactions are derived from autonomous system, right? Automatic reaction, autonomous system, right? And response to a increase heart rate, sweating, muscle tension and increase in the respiration, right? Then cognitive function. Cognitive components is like that: thoughts, interpretation, appraisals or for the situations. Fear, belief, expectation, like if I have a fear of fall, then I will not walk, right? You had seen in the Parkinsonism patient, they are having this short steppage gait, right? Why? Due to the fear of fall, right? It's like that only. Cognitive component, they are believing if I walk fast, then I will fall, right? If I walk slow, then it will be better for me, right? They know. It's the cognitive components, right? Then behavioral component include the observational expression of the emotions. If I observe someone is angry on me, by looking them, by looking at the face of them, then what will happen? Then I will recognize he will angry. He right now is anger in state, right? Right now. So I will, what I will do? I will not do anything. I will calm down to him. I will do some suggestions. If possible, then I will come, right? That are the behavioral components like the facial expression, crying, smiling, posture and tone of voice and avoidance. These are the 6 components are the most important in the behavioral component. Right? Now, we start with the types of emotions. Basically, we are having the 2 types of the emotions, primary and secondary. Primary emotions are mainly by birth. You will have this emotions in by birth only, right? And secondary emotions you will get by a family as well as the social environment, family environment that will give you emotions. It's the secondary emotions, right? Primary emotions are the initiate. Primary emotions are initiate, universal and present from the birth. That are universal. Everyone has the primary emotions. What are their? Happiness, sadness, fear, anger, guilt, surprise. These are the 6 emotions are most important because it's given by the Ekman Pavlov. Right? These are the 6 emotion you have to remember because and the that's given by the Ekman Pavlov. You have to remember by, right? It will ask in your exam, right? Then secondary emotions developed from the combination of basic emotions plus the social learning, right? What are they? Love, guilt, shame, pride, jealousy and embarrassment. Now, types of emotion you also divide in like that, positive or negative, right? So, positive emotions, happiness is the positive, sadness negative, fear negative, anger negative, disgust negative, surprise positive, right? Secondary emotions you will divide into love is positive, guilt negative, shame negative, pride positive, jealousy negative, embarrassment negative, right? You will divide according to the positive and negative emotions. You will also divide in the emotions into another type of the emotions like what? Conscious or unconscious emotions, right? Now, theories of emotions. These are the most important theories of the emotions. You have to remember the 3 theories of the emotion. First one is the James Lange, second Bird, third one is the Class-3. It's also known as the 2-factor theory. James Lange theory is like that: stimulus, physiological arousal and emotion. Let me give you one example. If you are saw a lion, what will you do? You will not do anything. At that time, your heart rate will get increase, your body, hand and feet and your whole body is shaking, right, sweating. At that time, you feel a physiological arousal. It will give you your signal to your brain to I have to express the fear, right? James Leys is all said like that. If you are giving any kind of this stimulus, your body gives you a first reaction, then your emotion will express, right? And Cannon-Bud theory, it's like it's opposite in nature. Cannon-Bud says like that, if you saw a lion, right, the body's reaction as well as your emotions, both are occurring simultaneously. Both are at the same time, at the same place. It's told by the Cannon-Bud theory, right? See, physiological arousal and emotion both are the simultaneously, right? Then the Scattle-Single theory is like that, two-factor theory. It includes the emotion is equal to physiological factor as well as the cognitive component. Cognitive component like that, someone teach you, लायन सामने आए तो क्या है, क्या करना है, भागना है, ये आपको पहले से सिखाया गया. It's a cognitive component. If you are in the real situation, what you will do? Your physiological bodies give reaction and your cognitive component add, and then you will feel the emotions of the fear, right? These three theories are more important. James Leys like the physiological arousal and the emotions. Both are first physiological arousal, then emotions. Cannon-Bud says like that, physiological arousal and emotion both at the same time. Scattered-Singer two-factor theory says like that, physiological component and the cognitive interpretation both are the same time, right? Now we go for the relationship between the motivation and emotion. We studied motivation and emotion. Don't know about what the reason or the relationship between the motivation and emotion. Motivation is like that, what you have to do, right? To start an activity, you need a motivation, right? But to continue this activity, that requires the emotions, right? Motivation energizes the behavior. Motivation gives you the full energy towards your behavior, right? But emotion provides the direction. Emotion. But emotions provides the direction and intensity of the behavior. Both influence the performance and decision making, right? What I told you, motivation gives you a energy to do some kind of the work, but emotions give you a direction as well as the intensity of your behavior, and both are influence the performance as well as your learning process. If you want to crack exam, that you need both the things, motivation as well as the emotions. If you are not having control on your emotions, then you will not study, right? Then the development of motivation and emotions. Early childhood experience the inflation of motivation and emotions. Whenever child born, at that time primary emotions are present, but at that time motivation is not present. It develops by the time, right? If the child learn how to interact with the society, social and language milestones are developed. Once they are developed, at that time the child have some kind of motivation. If you are giving the tummy time to your child, at that time they don't have a motivation, right? That's why they go into the supine lying position after that, right? So motivation it comes by the time, okay? Then emotions are present by birth only. Learning and conditioning play an importance role in the motivation and emotion. If learning, child will learn by the time, right? Then motivation and emotions, when the learning processes are continue, they are going to the in the single direction or the increase in direction, at that time motivation and emotions give a direction or intensity of the particular behavior. Social development or social environment shape the emotional response. I told you na, primary emotions are there by birth only, but secondary are developed by the interaction with the society. Social environment also provides the child to develop in the particular manner. If my child is experienced in their early childhood, like the child has not have the parents, the imagine the situation of the child have the mental trauma early childhood. So child they not have the confidence, they are lacking in the confidence in by if the child is grow until the teenage or adulthood, the child is lacking from the confidence on, right? So the social environment shape the emotional response. Now family influence. Family is the most important component to develop a motivation as well as the emotions, right? Let me give you one example. If you have a patient with the traumatic brain injury, he is paralyzed, quadruparesis, he is having the quadruparesis, right? At that time, the need of family, you can realize, right? The family need is too important. Then parenting styles affects the emotion and development. If the parents are not giving the proper time to their children, at that time the child will go into the, it will give a negative impact to the child, right? So family is the most important component in the emotions and the motivation. Family environment influence the motivation, emotional support enhances the confidence and achievement. This is the most important. I had give one example, child had not have the confidence, right? At the in that example only, the achievement is less compared to the child those who are growed into the positive environment, right? Now social and cultural influence, these are most important, because in the Indian population we are mostly the social and cultural influence is the, right? We all know our culture, Indian since last 50 years back, you know the culture of our Indian society, the importance they are given to the male child as well as the female child, right? At this components, it's influence their behavior as well as the motivation and emotion components. Society regulates the emotional expression. Our emotional expressions are based on the society. Compare both the things, like the if one both the child are there, if one child is grows in the high family, high rich family, and the another child grows into the poor and middle class family, they are not having the supporting environment, they are not having the some kind of the needs, they are not able to fulfill their basic needs. So both the states of the emotion and motivation looks are the two different, right? Then different culture shows the different emotional expression. If we are going to the outside of the India, at that time that their emotional expressions are too different, right? That's why we are not accommodate easily to the outside the India or the others, those are foreigner, they are not accommodate with the us very easily, because we are having the barrier of the society and the culture. Now, we'll see the rapid revision. MCQ number 1, a stroke patient attends a physiotherapy regularly only because the therapist wants that discontinuation may worsen his condition. This type of motivation is best described as. C. Physiotherapist wants. Physiotherapist wants to discontinue the treatment, it may worsen his condition, right? So what type of the motivation is there? Warning is given, right? Then what is warning given? Worsen his condition, right? What type of the motivation? Intrinsic? No. Why the physiotherapist give the warning? If he is coming regularly, then we don't have to give a warning. We have to give a motivation, positive response to them, right? So intrinsic motivation, not extrinsic. It may be self-actualization motivation. I don't think so. If he knows what will happen, then it will. So he will come, na? Then achievement motivation, no, right? Then what is the correct answer? Extrinsic motivation. We'll see the next option in the next MCQ. According to Maslow's hierarchy of needs, which of the need must be adaptively fulfilled before a patient can actively participate in the intensive rehabilitation? Which esteem needs? It's not, this is the fifth one, right? Esteem needs, fourth one. Cognitive needs, third one. Safety needs, second one, right? According to the Maslow hierarchy need, which need must to be adaptively fulfilled before a patient came to actively? What? We know, na? We have to give a higher number, 1 to 5. If the patient is fulfilled with the first need, then go for the second, third and fourth and fifth, right? Then second one is the safety needs. We'll see the next MCQ. A physiotherapist encourages a patient by setting a small achievable goals to enhance confidence and adherence. This principle is the most closely related to which theory? Which? Achievable rewards, that are the goals, right? To enhance the confidence and adherence. This principle is more drive reduction, to reduce tension, no. Self-efficiency theory, no. Cannon-Bud theory, yes or no? Yes. Then James-Lynch theory, not. The answer is the Cannon-Bud theory. Now we see fourth one. Which component of the emotion is most responsible for the increase in the heart rate, sweating during the anxiety before the gait training? We know during the gait training, if you had a patient with the lower limb fracture post-operative, then patient have a fear of fall, right? If you are giving the gait training, at that time the patient have the fear of fall, right? They have some kind of the emotions like that. At that time, the heart rate, sweating, they are increased. It's what is condition? Which component is there? See, we saw the three components, right? Physiological, behavioral and cognitive, right? So, cognitive, in cognitive, no, heart rate and sweating, no. Behavioral? No. Physiological component? Yes. Social? Not. Physiological component, because if you are having the fear of fall, at that times heart rate, sweating, muscle tension and breathing pattern, that will goes into higher amount, right? Now fifth one, patient smiles and verbally expresses satisfaction after the successful independent walking. This represents which component of the emotion? Patient smiles and verbally express satisfaction. They have a satisfaction by the independent walking. What is the physiological? Not. Cognitive? Yes or no? Yes. Behavioral? Not. Motivational? Not. Why cognitive? Because patients know if I walk, then it will give a confidence, it will help me to walk again, right? The next one, according to James theory of emotion, which sequence is correct in the patient experiencing fear during the balance training? See, in balance training, what you have to do? You have to ask the patient to stand on the balance board, right? Or other than else, tandem standing, tandem walking, right? Balance training. So if you want to a patient to stand on the balance board, at that time the patient have a fear of fall, right? So James theory, what James theory says like that, what? We'll see the options: emotions, physiological arousal and behavior. I think not. Physiological arousal, emotions and then behavior. Then behavior, emotions and arousal. Cognition, emotions and arousal. See, first we understood about the James theory. James theory is like that. First, stimulus gives the body arousal, physiological arousal, then emotions are expressed. These are the example of James. These first B, answer B is correct. Physiological arousal then gives emotions, then it's modified the behavior. Next question. A patient refuses the therapy after repetitive failure and shows a lack of efforts despite the encouragement. This condition is best explained by which conflicts? Refuses the therapy after repeated failures, that's important. Shows the lack of efforts. Lack of efforts, right? Which theory is inflict? Approach, conflicts, avoidance, conflict, learned helplessness, over motivation. What? Avoidance, conflict. This is the right option, right? Eighth one, which type of emotion most interferes with the motor learning during the physiotherapy sessions? Curiosity, not interference. Excessive fear, it will. Positive reinforcement, I think not. Mild anxiety, yes. The correct answer is the mild anxiety. If the patient have a more kind of the anxious about the gait training as well as the physiotherapy session, they will have the motor learning during the physiotherapy sessions, right? Next one. A primary purpose of motivation in physiotherapy rehabilitation is to reduce the therapist workload, increase the treatment cost, improve the patient adherence and outcomes, replace manual therapy. Improves the patient adherence and the outcomes. If the motivation, if we are giving the motivation to the patient, it will reduce our workload, but it's not a correct option. Last MCQ. Which theory emphasize that emotions and physiological response occur in this simultaneously during the pain perception? See, this word is the too important. Emotions and physiological arousal at the same time, right? Which theory? Cannon-Bird, right? See, today we covered the whole topic of motivation and emotions. If you are having any doubt, let me ask in the chat box, as well as we are also having next our doubt sessions, right? You can type and you can ask, we will give the answer to you. We solve each and every question of yours, right? And if you are having any query related to our course, related to our sessions, related to our topics, then you ask in the chat box. We'll solve all the queries and all the problems of yours, right? And thank you for watching me and bear me for 1 hour, right? Okay, see you.